Did you get to the inside? Cool.
Okay. Imagine you are doing what you love to do the most. Maybe it's cooking, riding a bike, playing your favorite sport, or it could just be laying in your bed on your phone. All of a sudden, you can't breathe, your heart starts beating rapidly, and it feels like an elephant is sitting on your chest. At this moment, you're probably thinking, am I dying? Am I having a heart attack? Is my heart going to burst? This is what it feels like when you are having a blood clot, typically to your lungs. In my speech, I'm going to be talking about how blood clots form, the signs and symptoms, and how to treat them. We all know what a blood clot is, right? Well, if you don't, they are a gelatinous mass of fibrin and blood cells formed at the coagulation of blood. That sounds like a mess. So the gelatinous mass is a thick and it's jelly-like, so that is actually the mass that stops you from breathing if it's in your lungs. Fibrin is a insoluble protein formed during the clotting, and a coagulation is a change into a solid. Now that we know what blood clots are, how do they form? When you first have to have a blood clot, you have to have an injury. So when your blood doesn't run through your body like it's supposed to, like after surgery, much like a scab will form like after the cut, a clot can form inside your body. If you injure your leg and there is tearing of the muscle and arteries and bleeding inside your body, clots will form to stop the bleeding. These clots can enter your arteries and may cause it to be blocked, traveling through the blood vessels. Blood clots happen through the veins and arteries. Veins carry deoxygenized blood away from the body's organs and back to the heart. It happens in this because when it is done healing, the wound usually dissolves, but it comes back and gets stuck in the vein, which results in not being able to breathe. Arteries carry oxygen and nutrient-rich blood from the heart to other parts of the body. When this fails, you can't get healthy oxygenated blood to the damaged blood vessels. Blocking blood flow. If a clot blocks blood from getting into the heart, it leads to a heart attack. If a clot blocks blood from getting pumped into the lungs to get oxygen, you could die. The signs and symptoms. If you have fainting, irregular heartbeat, lightheadedness, rapid breathing, rapid heartbeat, it usually means that you're having a blood clot to your heart or lungs. And then the symptoms, blood in your urine, fever, or high blood pressure. And if you're having a blood clot in your legs or arms, it usually means swelling, cramping, tight pain, tenderness, redness, or bluish tone. If you're having one in your brain, which also means like a brain tumor, severe headache and trouble seeing or speaking. The treatment for a blood clot, you could do medicine that prevents clots from forming. That is anticoagulants. Medicine that dissolves blood clots is thrombolytics. And a procedure in which a long tube called a catheter is surgically inserted directly toward the blood clot where it delivers clots. And then a surgical remover of a blood clot is a thrombectomy. In my speech, we went over how blood clots form, the signs and symptoms, and how to treat them. You can't always treat a blood clot either. My dad died from a blood clot, and it was unexpected and it happened instantly. There are still ways you can catch and treat a blood clot. I highly recommend looking or curing disease any person may have because you never know what could happen.